Welcome back. Everyone remembers where they were on September 11, 2001. The events of 9/11 resulted in the creation of the West Virginia Center for Threat Preparedness under DHHR. It was established first through federal funds. Here's a look back from one local news report that aired on the 5th anniversary of how West Virginia responded following the September 11th attack.
Nightmares. Armageddon right here. I'm okay. I'm okay. Top floors collapsed down.
8:46 a.m., 2001. Horrified West Virginians watched in disbelief as a hijacked airliner slammed into New York's World Trade Center. What followed looked like hell. Almost immediately, all flights in the U.S. were grounded, including those at Yeager. Extra police officers were called in. Hundreds of passengers were instantly stranded.
Any safety precautions they want to take, I'm all for.
And while the terror was happening hundreds of miles away, West Virginia lawmakers, in the midst of an important special session, had to evacuate the capital.
We're in trouble in America. These terrorists are making victims of us all.
We must remain vigilant. We will secure our state buildings overnight.
West Virginia virtually shut down, closed all government offices, including federal buildings, city halls, and county courthouses.
An awful lot of sadness. I mean, it's a terrible day for America.
I'm in shell shock.
Also shut down any kind of mass transit, even the mall. In Chemical Valley, companies shifted into high alert, and residents feared the worst.
We're gone if they hit.
But amid the chaos, public schools remained open. Parents, however, were allowed to take their kids home early, and blood banks overflowed with donors eager to help in any way they could.
I got a big heart for children. If maybe I can help some small child out.
Within hours, prayer vigils sprung up everywhere in West Virginia, feeling the need to be together, but knowing America is never going to be the same. In Charleston, this is Sarah Lou reporting.
Joining me now to talk about the Center for Threat Preparedness and National Preparedness Month is Luke Mitchell, Public Information Spokesperson for the Center for Threat Preparedness. Luke, thank you for being here.
Thank you for having me. I'm glad to be here.
Tell me a little bit about why September is designated as National Preparedness Month.
Well, preparedness always existed. It was always around. Work in preparedness was happening with natural disasters, bioterrorism. But really, the September 11th attacks formalized the preparedness initiative, really formalized it and made it broader perspective. That's how our center came into existence through federal funding after the September 11th attacks, and so did National Preparedness Month.
And I think it's important that we think about, if we just saw the footage, what happened on September 11th, and being prepared is critically important for all of us. As an individual citizen, I have to think about how do I get prepared? Can you give us some advice or tips on what do we need to do to be prepared should an emergency occur? This type of thing that we all know is, something that can happen at any time.
Definitely. This National Preparedness Month, the theme of it is don't wait, communicate, make a family emergency plan today. So that would be a good place to start. With that in mind, we were thinking family communications plan. Contact information for your loved ones. Place that in your child's backpack. Should a disaster happen while you're at school, you're separated, they can get in contact with everybody. When you're at home, make a evacuation route. At what point are you going to evacuate? Where are you going to go? Things like that. Have a conversation with your family. Get your family involved, and things may develop. Things may come up that you didn't know. That's a good place to start. And also, generally speaking, a preparedness kit, a personal preparedness kit is a big tote. It has all the emergency supply items you would need in that event. It'd be centralized in the house. Everybody knows where it's at, and they would go to it and get it should that be necessary.
Now, I know that, everybody's going to want to know, the communication plan's a great idea. I mean, yeah. I think that we don't think about that.
Definitely.
How do you get in touch with me? Who do you get in touch with who can't reach me for my family? And that's easier for us to do because we can sit down and talk about that as a family and write that out.
Right.
A kit. Some people may say, I don't know if I can afford a kit. What should be in that kit? Some advice in that on that?
Yeah, sure. You can find preparedness on a budget materials on our website at the Center for Threat Preparedness. You can do preparedness on a budget. That's actually a document we have. Setting $5, $10 aside each month. A lot of times people go out to dinner and the movies. A family could easily spend $30 to $100. Put that towards preparedness items. Give preparedness items for gifts, for Christmas, for birthday. And discount stores are perfectly fine for these items. They work fine.
That's great. Are there a couple of things that are just, major things? You want to make sure people say, okay, I've got that in the kit.
Definitely, yeah. We always say water and food. I mean, that's the obvious, but emergency supplies would involve your medical supplies, gauze, Band-Aids, any kind of bandages, ointment like that. You would want to have flashlights, backup batteries, tools to shut off utilities should you have to take your things and evacuate, your personal preparedness kit. So that's a basic, but we always want to stress that you should tailor your kit, make it as individual and unique as your family. You may have different situations in your family that the next family would, so it can only be as individual as your family.
And I think those are all great suggestions to really think through exactly what it is that I need in my family.
Definitely.
Other than the basic things that we know we all might need. Magic number 72.
Yeah.
We hear that in our world. Tell us about that, what it means, and maybe so that the public can understand that.
Yeah, you need 72 hours is the allotted time that you're supposed to take preparedness into your own hands. That's what the federal government wants you to do, and you could be taking your family's consideration, and you should go from safety to comfort items. You need food, water, but we stress a gallon of water per day per person for 72 hours or 3 days. And so that magic 72 is pretty much what you need to have within reach to take care of preparedness into your own hands and take care of your own family.
And I know that's true. We hear that in the healthcare setting all the time.
Sure.
We all need to be prepared for the 3 days worth of whatever it is that we need. I know that the Center for Threat Preparedness is basically health and the medical side of the Homeland Security. Can you tell me a little bit about that? Sort of close our segment with understanding how we fit into Homeland Security.
Sure, yeah. We like to say with the health and medical side of Homeland Security, we support and assist all the public health and medical systems throughout the state. And by doing that, we work to respond to anything from a natural disaster or get out in advance and plan for emerging infectious diseases such as Ebola or anything like that. So the health and medical side of Homeland Security in a nutshell is the best way to put what we do.
Now, I know some people may ask questions, in an emergency situation, the health and medical side is really critical, right? I mean, we are, front lines in many types of emergencies, as you talk about, whether it's infectious disease or, dealing with a flood, as an example. How does the medical side fit into things like a flood? We think of it when we're talking about infectious disease, but let's talk about the importance of things like flooding and other types of disasters and how the medical side is important to that.
Yeah, the health and medical side, take a flood for instance. We monitor different systems and their resource requests. We'll monitor them and try to fill them in. But during those resource requests, you may get a pallet of water as a resource request, mops and bleach to help the contamination of a flood, the backwater and everything. So, I mean, health and medical, it comes in from every aspect of preparedness.
And I think that's important for us to know. It's critical. We're all in this together, and that all of the agencies working together, we're the ones who are ready in West Virginia. I'm proud of the work that you do, and I'm proud of the work that we do in West Virginia as it relates to this. So thank you so much for being a guest and for, talking to us about this very important topic today.
Thank you so much for having me.
That's all the time we have for today's show. Remember, you can always follow us on Facebook, Twitter, and our website. I'm Karen Bowling, Cabinet Secretary for the Department of Health and Human Resources. Thank you so much for watching The State of Health here on the Library Television Network.